Good morning. So, as we are discussing with the antidiuretics, so in the last part of the antidiuretics, we'll see their uses and adverse effects. So, desmopressin, it is the drug of choice. Mainly, it is used into the V2 action. Let V2 action. So, as we have already discussed about the diabetes insipidus. Now, in case of the diabetes, what is the diabetes insipidus and diabetes mellitus? Difference already we have discussed. So if DI is the pituitary origin and it is most important indication for the vasopressin. But it is ineffective in case of the renal DH because ADH it is not going to or the vasopressin is not going to affect on the kidney. So if it is renal diabetes insipidus, then these drugs will have the no effect. Lifelong therapy is required except some cases in case of the head injury or the neurosurgery. So in such cases DI occurs transiently. So in such condition there is no requirement of the use. Next is bed wetting in children or the nocturia in the adults. So in such cases either the intranasal or oral desmopressin at the bedtime useful to control such condition and reducing the urine volume. Next is renal contraction test. To test the renal contraction, we can use the aqueous vasopressin or desmopressin. So if we are using the aqueous vasopressin intramuscular injection 5 to 10 unit or desmopressin 2 microgram we can give. Other than the hemophilia, von Willebrand disease, in such condition, aqueous vasopressin may check the bleeding by the releasing coagulation factor 8 and von Willebrand factors. So, in such condition also, desmopressin is preferred. Now, uses mainly we are concentrating into the now V1 action. So, bleeding in esophageal varies. So, in case of the vasopressin or the termipressin, often used to stop the bleeding by causing the constriction in the mesenteric blood vessels and reducing the blood flow to the liver and allows the clot formation. Other than that, before the abdominal radiography, these drugs can be occasionally used, occasionally used. So we can see the different uses which is through the V1 and the V2 action. Adverse effect, desmopressin produce the fewer adverse effect compared to the other drug like vasopressin or its other analog. However, transient headache, flushings are frequent. Nasal irritation, congestion, rhinitis, ulceration, etc. can be occur when we are used as a topical. Systemic side effects are bleaching, nausea, abdominal cramps. These are the, or you can say the uterine contraction, it can be there. Fluid retention and that is the hyponatremia may develop. So these are the different adverse effects. So hope you have understood and for details you can go through these references.